Hey everyone, it's the second walk and talk, and this time I want to talk about patient comfort. I think it's so important. I have patients that come to me probably several times a month and have just had an experience with a prior aesthetic procedure, and it's been really uncomfortable. And honestly, I feel like it leaves almost a post-traumatic stress loop. If things haven't been explained, the procedure goes a little bit unexpected, or it's just painful, it resonates with their body, and I think it stays there, and they anticipate that that's what it's going to be like next time. So what do we do to make patients comfortable? Well, number one, I think, is setting the room, explaining what you're going to do. As an aesthetic dermatologist, if it's appropriate, I've had a lot of the procedures in our clinic, and I feel like that gives me an opportunity as a board certified physician to explain to patients what a procedure is actually going to be like from firsthand experience. Secondly, we have a topical numbing that is the balm. It's got tetracaine and lidocaine in it, and typical percentages that we use in aesthetic dermatology. But something about this base, it is great. I sometimes sing the song, "I Can't Feel My Face When I'm With You," because it's that great. Secondly, there's a lot of things that we can layer on orally or intramuscularly to help with bigger procedures. So Tylenol is actually a great pain reliever, and we sometimes will combine that with other things that we're doing. If a procedure doesn't require a lot of injectables, sometimes we'll add in a little bit of Advil. We can do that with the Tylenol. And then there is a new pain medication that is a narcotic, non-opioid, that works in the same way lidocaine does. It switches the peripheral sensory nerve fibers, so our brain doesn't get the signal that we're experiencing pain. And I love this new oral medication. So we've been layering that on with some of the topical measures, some of the other comfort measures that we're doing in the office. I actually tried it myself when my lovely PA Stephanie was doing some injectables on me this past week. And I told patients it's almost like it put sort of noise canceling earbuds on pain. I just couldn't sense it as much, which is wonderful. So for lip filler patients, for patients undergoing energy-based devices, cool sculpting, skin tightening procedures, we have been layering this on, and patients have said it's made a huge difference. So just wanted you to understand there's a lot we can do. When I am doing procedures like laser skin resurfacing, which is probably one of the tougher lasers that we do, in addition to some of the things I've spoken about, it's so important that we do nerve blocks. And I'm not talking about just the typical three that a lot of people do: your mental, your infraorbital, and your supraorbital. Over 16 years, I've kind of been perfecting comfort, and I end up treating probably about 12 different nerves in the face so that patients are comfortable. I get really upset when I hear patients have had less desirous outcomes in terms of comfort. And I think that's our duty as physicians, to make sure patients are aware that they're comfortable with their environment and that they're at ease when we're doing procedures. So that's my bit on pain, because I'm a bit of a wimpy patient myself. And just want you to know that if you're going to the right office, they're thinking about this, and it's paramount to your experience. And be selective in who you're choosing to do your procedures. And with that, enjoy your day.